Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are joined once again by Betty Jo Rocchio, who is the Executive Vice President and Chief Nurse Executive at Advocate Health, about her career and her thoughts about trends in the nursing industry. So, hi, Betty Jo, how are you?
I'm doing great, G. How are you?
I'm doing so well. Thanks for coming back again. All right. Well, first of all, congrats on your new role. I'm super
Thank you.
happy to watch your career blossom.
It is blossoming,
Mhm.
absolutely, and I've enjoyed every minute of it.
Good, 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 good. So, we've spoken a lot in the past for health leaders, but I wanted to pick your brain about your career today. So, how did you begin your journey into nursing?
It's interesting. My mother was a nurse, right? I think all of nursing has some type of connection to nursing or wanting to go into nursing. And my mother was a nurse. And so I watched her my entire time growing up. Uh,
Hmm.
how she was a nurse and she worked in the operating room. And so I guess probably there, she was probably my biggest influence, both in life and in career choice.
Hmm. Absolutely. So, was there anyone else other than your mother who influenced you in the industry?
Well, I've had a lot of great influences in the industry, but probably some of my best leaders were informal leaders that weren't necessarily directly responsible for me. But I'll give some credit to my physician colleagues out there because surgeons taught me a lot of what I know about leadership. So I started out in an OR. I'm a nurse
Hmm.
anesthetist by background and then moved into leadership from there. And I
Hmm.
will tell you, they were great leaders. We started a for profit orthopedic hospital together, and
Oh,
I learned
wow.
a ton about leadership very, very early in my career.
Hmm. That's really cool. So what was your best mistake and what did you learn from
A lot of mistakes, that's for sure, along the
it?
way.
Hmm.
But that's a great way to put it. What do you learn from them? Because I think every great mistake leads you down a path of either self discovery or how you
Hmm.
got out of it teaches you some life lessons in leadership.
Hmm.
And probably my biggest mistake early on was assuming that things have a regular cadence in healthcare and
Hmm.
that things remain static a little bit in the leadership lane. And what I learned in healthcare was that it absolutely is not like that. It's an
Hmm.
everyday challenge to make sure that you're staying up with current need. And one of the biggest mistakes was probably putting in a technology
Hmm.
in a little bit too early before we had processes ironed out. And then we had to go back and pick up and make that technology right. So technology can be a great disruptor. It can also
Hmm.
be a horrible disruptor if it's not
Absolutely.
handled appropriately. And I think we're here today in that same spot. So hopefully I've learned from some of those mistakes and going forward in a little different way.
Absolutely. Yeah. I for sure. I've heard that from several nurse leaders with implementation of technology. It takes a lot of communication and pre-planning and all of that. Absolutely. Yeah. So, what do you think are some of the biggest challenges currently facing CNOs?
Yeah, we have a lot on our plate, but I like to boil that down into three things. Workforce is
Mhm.
it's a continual challenge. It has been for years, but it seems like as we have a little bit more acute patients, we have a lot more baby boomers needing healthcare. I think that nursing is right in the middle of that stress point. So I think workforce is one of them. And then workflows, all the
Mhm.
technology that we're adding into healthcare, period, not just in the nursing lane, but all the technology coming in that nurses have to interact with.
Mhm.
I think we don't realize in their workflows how much they actually have to overcome to take care of patients. And then that third lane would be our work environment. It has
Mhm.
changed dramatically over the years. How nurses have to work in different sites of care and the
Mhm.
unique opportunities that come with that. I think blending those three things is where care delivery change is going to happen.
Absolutely, the three W's, if you will.
That's right. That's right.
Yeah. Yeah. So, what are your thoughts on, speaking of workforce, some strategies for recruiting new generations of nurses and retaining more seasoned generations of nurses?
I still think flexibility is at the top of the list for that workforce layer. People
Hmm.
want to work differently today. We've shown them a different life during the pandemic inside of healthcare and outside of healthcare.
Hmm.
And so their friends have flexibility. We need to provide some of that flexibility. And it's that give and take between what the patient needs are and what the nurses' needs are. Somehow we
Hmm.
have to match them up in a way that allows us for flexibility to be there, but also has those needs taken care of. And I think that's one of our biggest challenges of workforce.
Hmm. Absolutely, especially with, as you mentioned, new technologies. There's all kinds of different ways to work in nursing now. So flexibility is probably more attainable than it used to be, but still definitely a challenge. So part of recruitment and retention efforts include diversity, equity, and inclusion. Obviously, we want patients to be served by people who look and think like them. So how do you think CNOs can incorporate DE&I into recruiting strategies and into patient care?
Well, what I will say is, first of all, they have to be there to recruit. And so
Hmm.
I think we need to back up as a nursing community and take a look at how we're supporting that diverse group to go into nursing, period. Are we
Hmm.
reaching out and making sure they have what they need? They are having the experiences. I will say, even at a junior high level, to be able to get in. And so, if we're doing things like summer camp and things that expose
Hmm.
students earlier to it, we should be exposing it to the right population. And I
Hmm.
think that allows us to have the selection to pull them into that nursing career and field and supporting them with what they need to get there.
Hmm. Absolutely. And speaking of support, obviously, workplace violence is a very prevalent issue in nursing, unfortunately. So, how do you think that CNOs can help prevent workplace violence and also support overall nurse well-being?
So I think they're highly, highly correlated. If you look at the data on this, you can see that nurse burnout happens in work environments. And I look at the
Hmm.
work environments in two ways, not only workplace violence, but a clean, coordinated workflow and work environment that gives nurses a place where they can spend more time with patients. And I
Hmm.
think they're correlated, and I'll tell you why. Nurses that build relationships, have time to build relationships, and understand the patient care needs at a very fundamental level, have the opportunity to create that workplace that has less violence in it. Now, I'm not blaming nurses in any way, shape, or form. The relationship, right, sometimes doesn't avoid some of the violence. So, but I think that's a great first start is to make sure that we're forming relationships and taking care of needs. And then having the barriers to help us prevent violence in our settings, all settings, ambulatory, acute. We have hospital at home now, right?
Hmm.
There's other workplace violence things that can be involved there. But where we can control that environment, have our safety and security at the front lines with us, making sure that we're screening for weapons coming into any type of environment in healthcare. I think it's going to be important moving forward that we have great mechanisms in place and that we're working with our safety and security. I'm going to give you an example, G. In Advocate, I have a physician partner who focuses with me on workplace violence.
Hmm.
And he does a very great job from a physician perspective. And then I get to weigh in from a nursing perspective on what that safety in that work environment looks like. We are starting to launch um, bands and badges on nurses that have panic buttons that they can get
Hmm.
help no matter where they are. We can track them by their badge, but them actually signaling where they are and getting help to them if they need it. I think that's a form of safety and personal security that we should be providing at the front lines.
Hmm. What have been the outcomes for that strategy?
We're just now deploying the full strategy. I don't have
Okay.
many outcomes, but I can tell you by talking with our professional governance leaders and advocate, they feel better knowing that they can get help no matter where they are. If they're in a remote patient room trying to help somebody, or, they're
Hmm.
in the cafeteria, they can literally get help whenever they need it. That just gives you the sense that somebody is there to help you and can get there when you need them most.
Hmm.
So, because, we're in weird environments and we can't always, people can't always see us. Even if we were to yell out, sometimes people can't hear us. So
Hmm.
this just gives them that kind of extra layer of security that they can be tracked and we can get help there.
Absolutely. Yeah. The few times I've been in health system settings, it's very much like a labyrinth in there. So
It is.
yeah,
It is.
yeah. So what's the response time on the panic button? I'm just curious.
Yeah, which obviously depends on where you are, but we
Hmm.
monitor those alerts from a central system, and then we have security officers throughout the whole hospital. So it depends on how close that security officer that's paged, the closest one, can get to them. We can also track the security officer so we know how close they are to that situation. So not that more than one person usually responds, but it has to do with how centrally located they are to whoever the person needs the help, but they get there fairly quickly. We know that that's a top priority.
Absolutely. So I know we've spoken about this topic before. What are your thoughts on AI and how do you think it will continue to impact the nursing industry?
Well, if you will, and I love how you branded it, the three W's,
Hmm.
it's going to go in every single layer. When you look at
Hmm.
changing the care delivery model, there's only so much you can do without coordinating the technology. And I think that AI layer allows us to remove some of the disparate technology and really start to combine it so the workforce feels the workflows and the work environment are very coordinated and that they can get information out of the electronic health record when they need it in a coordinated fashion. I mean, you know this. We work in the electronic health record as nurses more than any other profession. And what you start to see is we all work in lanes. And so there's different
Hmm.
pieces of information that help nurses make different decisions had they had that information. And we don't have the time to scour and put that together for ourselves. But if we could get that information in a coordinated way, the way
Hmm.
AI can bring it together, I think it opens up the world and decreases cognitive workload for that nurse. And that's really what it's about, G. When you look at,
Hmm.
I'm passionate about this. So when you look at where we're shortest, it's in
Hmm.
medical surgical nursing.
Hmm.
And there's a reason for that, right? It has a higher cognitive workload than even an ICU nurse because there might be more acuity on the ICU side, but they have
Hmm.
one or two patients. But on that med surge
Hmm.
side, right, people are sicker in hospitals today, but they might have five patients. And trying to get the information coordinated across all five patients, that's workload of the nursing brain. And so if we can take that off of them and put AI in the right spots,
Hmm.
to help them through their vision, not our visions, right? But through how they need the information, I think we could really help them have a better day on the units.
Absolutely. Yeah, I think it is all about reducing that administrative burden. I think both for nurses and physicians. I've heard it from both parties. Um, yeah, so part of the CNO's role in a health system obviously is advocating for nursing, whether it be in the C-suite or elsewhere. So I wanted to ask you, how do you think CNOs can get involved in the legislative process to advocate for nursing?
Well, I think a very good start is understanding your professional organizations and where they intersect at that legislative path and
Hmm.
making sure that you're active and that you are on committees that allow you to interact with some of your legislators. And I also say, know your legislators. There's nothing
Hmm.
wrong with reaching out and being that key source of information when legislators need a little bit of that feedback and help on certain healthcare topics. Also participating in your boards of nursing. I mean, where we have the opportunity, we should be getting our voices out, and it needs to be from the front lines. They're in the operations of nursing and the practice of nursing every single day, and they probably have a lot to add to the conversation and the way we look at things from a legislative area. So I would say get involved in professional organizations, your boards
Hmm.
of nursing, and make sure that you're active in your capital or state house days.
Absolutely. So, once again, congratulations on joining Advocate Health. So we've talked about a lot of issues and challenges facing nurses. So, how are you planning to address these challenges at Advocate Health?
By a very strong amount of teamwork, not only in nursing, but across
Mhm.
the organization. Nursing is an ecosystem, right, that takes care of patients, but in healthcare, it takes all of us working
Mhm.
together to make it happen. While we own our nursing practice, there are many other practices that occur in healthcare that require different levels of leaders to look at things and different operational leaders. And so, how do we create that ecosystem within nursing that both takes information in from the healthcare environment and also gets our opinion and our needs out? And then, how do we make sure that we're in every crucial conversation where nursing needs that voice?
Hmm. Absolutely. It's all about communication and creating those feedback loops. Yeah. So to pivot back to you personally, what are you most proud of?
What I'm most proud of is the team that we're building at Advocate. I see myself as only one cog in that wheel. While I might be the leader of our enterprise nursing function, I'm proud of the team and how they come together. I've been at Advocate for 9 weeks now, and I will tell you
Hmm.
the most amazing team leaning in to make sure that our 2025 strategic plan is organized, and how they have thought about how to position nursing within the organization has been amazing. And so just making sure that we have the right team and they're in the right positions, that's what I'm most proud of so far. And we have many more things to do and many more projects before we're done.
Absolutely. And then do you have any advice for CNOs?
Yeah, I would say think differently. I think the way you think about solving the most wicked problems in healthcare today, outside of nursing as well as within the practice of nursing, leads you down a path that you probably wouldn't solve any other way. So, framing the question correctly and bringing in resources that are even sometimes outside of healthcare to solve some of our problems is going to be our success in the future.
Absolutely. Well, thank you so much, Betty Jo, once again for your time. I'm grateful to have had this opportunity to speak to you again. And thank you so much to our audience for listening.